care to vulnerable communities. UNC Department of Family Medicine ranks second in the United States and has been ranked among the top 5 family medicine departments by the U.S. News & World Report over the past decade. The Teaching Health Center will give family medicine residents a very real experience of caring for our vulnerable neighbors, increasing the likelihood that those doctors will begin their professional practice in rural communities across North Carolina.
The Community Health Center track is all about training residents for service in communities of need. We want outstanding students who are committed to service and want to make a difference.
With academic and clinical linkages to UNC and a practice that has been grounded in the community for over 40 years, Piedmont Health is the ideal setting to train as a resident. Piedmont Health provides a team-based care model that ensures all patients have timely access to quality health care. You may care for a patient and work with our pharmacist, care manager, dentist, dietitian, all focused on improving the patient's health.
Traveling along a scenic country drive, the Prospect Hill Community Health Center is located just north of the UNC School of Medicine. Nestled in a rural community that had not had a doctor since 1957, Prospect Hill was Piedmont Health's first site. Since that time, Prospect Hill has seen tremendous growth. With a new center completed in 2011, Piedmont Health continues to address the needs of the community as more doctors and medical residents are enjoying the rural setting.
I think if I had received training in the community health center setting, I would have felt better prepared to tackle the challenges presented to me in working here at Prospect Hill. I feel that particular patients and situations I encounter on a day-to-day basis are unique in many ways, where training in a traditional academic setting did not fully prepare me to navigate, so to speak, healthcare in this environment as effectively and as efficiently as possible.
As a graduate of UNC Family Medicine, the team atmosphere at Piedmont Health Services is one that takes care of the total patient. From the PCC to the medical assistant to nursing, pharmacy, dental, WIC, and nutrition and care management, we make sure that the patient gets everything they need within these walls.
As a young adult, I spent a lot of summers working in Latin America on public health projects in rural communities and realized how rewarding it can be to help make a difference in people's lives through giving good health care. I chose this track for residency knowing that I'd have that opportunity here in Central North Carolina.
I chose the underserved track because it's an incredible opportunity to work with patients who most need medical care. Over 60% of our patients at Prospect Hill are Spanish-speaking, and I especially enjoy working with the immigrant Hispanic population. Participating in this track will allow me not only to serve patients during my time at UNC, but it will also springboard my career after residency working with similar populations in North Carolina and abroad.
One of the things that we're doing today with Piedmont is to work together to strengthen Piedmont